Hello viewers, Nagaland pacha nathaka couple khan karone khushi khobor ekta ase ki apuni kan pacha lobo mon jai ase holebi treatment karone Guwahati jabo mon nai noile paisa laga dorkar ase gole itu sob jhanjat khotom hoise Nova IVF Fertility, India's #1 self cycle expert, already Dr. Belho'S Clinic and Children Hospital Dimapur already ahiluche aro jun manu IVF treatment lobo mon jai ase noile IUI treatment lobo mon jai ase Peshi kumdi dam de treatment be start hoishi guna honi paise aji 18 April IVF free camp Dr. Belho'S Clinic te already digina more than 20 patients aigina attend kurishi guna amigan honi paise to viewers saibi idulaga opode Dr. Belho'S Clinic and Children Hospital along with Nova IVF Fertility takan ba idulaga opode press conference ekta dibule ase ko ase to viewers saibi takan jundu IVF treatment di ase nole IUI laga treatment di ase poisa to be reasonable ase na nai idu sob laga opode health risks ase na nai nole pacha kan IVF babies pa do idu kan do healthy ase na nai idu sob laga opode abi detail bra hota hoti kuri sabo
Thank you, media, for having us. And I am Dr. Belho, proprietor, managing director, and consultant gynecologist here at Dr. Belho'S Clinic and Children's Hospital. And here with me is Dr. Raman, the specialist gynecologist of Nova IVF. He will later brief you regarding the infertility and other methods. And here we have Dr. Emmanuel, my partner and colleague, who helps me at the center. And thank you so much for being with us today. It is a very special occasion. Bishay khushi din ase aji, because especially after after many years, we are coming to this stage where we are able to bring affordable fertility techniques to Dimapur. And the most important thing about Nova IVF, I would say, is the accessibility and the affordability. And with that, I'd like Dr. Raman to continue in regards to Nova IVF. Nova IVF also here, we are happy to partner with them in Dimapur. Across India, there are many Nova IVFs now, even in Southeast Asia. And with great success, they have already attained 1 lakh deliveries with Nova IVF so far. And it is in collaboration with Nova IVF of Spain. And we are happy to partner with Nova IVF in Dimapur.
Thank you. Good evening, everyone. Respected members of the media and colleagues and friends. It's really a proud privilege on my part to be addressing this media on this very special day. Let me make a few quick points for the viewers that I am born and brought up in Dimapur. I did my schooling in Holy Cross School, and way back in 1982 I passed from Holy Cross. And then I was away studying for my medical courses and other things. I was in USA to do my fellowship in the year 2002, and then in UK for further studies. So today is a very important day for us, because we are starting IUI clinic here in collaboration with Dr. Belho'S Clinic and Children's Hospital. I am associated with this hospital owner, Dr. Belho, who is the senior Belho, and you will be happy to know that he was one of the pioneers of obstetrician and gynecologist of Nagaland. And I had the honor of working with him for a few months way back in 1992 in his old nursing home in a main city. So I learned a lot from him before I started my journey for my further post-graduation and all. So I had the pleasure of working with him. Now I have the pleasure of working with the second generation, his daughter, Masasino Belho. And hopefully I'll be continuing my association with them for the third generation as well. Hopefully one of our daughters become doctor and carries on with her legacy forward. Having said this, let me give you a quick recap of the problem of infertility in our society. We had done a statistical data analysis of the incidence of infertility in Northeast India, and we found that 1 in 6 couples will face difficulty in getting a baby after they get married and having regular intercourse for 1 year. So this incidence is on the rise. So we exactly do not know what precisely is the reason of increasing infertility and childlessness. We did a few research and found that 50% of the cases of infertility lies with the male partner. Earlier though, we used to think that the whole blame we used to put on the female partner. But now with modern technology and testing, we found that 50% of the cause of infertility lies with the husband and 50% with the female. Similarly, lifestyle changes have occurred of late. Increased use of smoking, drugs, and other substance abuse plays a very important role in declining fertility rates. We are living in an era where people get married late. This is one of the prime reason of infertility rates increasing, especially in case of women. Nowadays, women get married at later ages. They don't want to become mother very soon. They postpone their first child for a few more years. And by the time they reach 40 or 42 years of age, and when they plan to become a mother, their ovarian reserve decreases and it becomes very difficult to conceive naturally. So this tie-up with Dr. Belho'S Hospital and Children's Clinic and Children's Hospital is aimed at looking after the childless couples of Nagaland as such, where they find it very difficult to go to Guwahati and other higher centers because of logistics and the travel and the finances involved in staying there in Guwahati, plus the language barrier that happens in many cases. So we have decided that we will set up this IUI clinic here, and then we will give the treatment to the deserving couples. So IUI is a treatment where we take the sperm of the husband and we wash it and then put it inside the mother's womb. And then after the pregnancy takes place, she will be looked after by the staff of Dr. Masasino Belho and herself. She need not travel to Guwahati. The entire apparatus for doing an IUI, state-of-the-art apparatus, are already here in this hospital. So our main aim, which is our motto, is to do our job transparently and at an affordable cost, because most of the patients of our region are not well off to spend a lot of money. So we will be doing the treatment at the least possible cost so that it benefits all sections of the society. Simultaneously, we will also be starting IVF in the future. We have a plan of doing this, and right now part of the IVF will be done here, especially the stimulation part, so that the patient's stay in Guwahati reduces considerably. So first 5 or 6 days of stimulation will be done here, and they have to go to Guwahati for only 7 to 8 days for the ovum pickup. So this is our step forward. We have put our footprint here, and we hope that the association of NOVA with Dr. Belho, Masasino Belho and her team continues in future, and we are able to serve the childless couples of Nagaland. With this I end, and I would request our NOVA head of the center, Guwahati, Mohit Singli, to speak a few words regarding our NOVA clinic. Mohit, please take over.
So hello everybody, my name is Mohit Singla. So I am the center head of Nova Ivf Guwahati. So Nova is primarily known for three things. One is being the transparency in the pricing, and we mainly focus on self-chemics. We focus on self-cycle as per Sir said. So most of our cycles, most of our pregnancies, they come out from self-cycle itself. Apart from that, we have a team of experienced embryologists and our consultants as well. So yes, that's pretty much it. Apart from that, Mumbai has now spread to all across India. We currently have more than 160 plus centers all over India, and we are also now operating in Bangladesh as well. So this is all from me.
If you have any queries regarding the treatment protocol and anything else, we are ready to answer your questions.
Are there plans to collaborate with other hospitals in
Right now we have put our center here, our instruments here. So we are in touch with all the gynecologists and other doctors of Nagaland. So whoever gets such kind of patients who need IUI treatment or IVF treatment, they can refer cases to Belho'S nursing home and children's hospital, and especially to Dr. Masasino Belho, who will take over the cases and refer them to us if needed for IVF. If the patient is for IUI or for basic ovulation induction and stimulation, she will do it here itself. So we cannot open such centers everywhere in all the hospitals. So we have centralized it over here so that doctors can refer their patients over here instead of sending them to faraway places like Guwahati, Calcutta or Delhi.
I think viewers will also want to know after how many failed cycles of IVI the patient is referred to IVF.
IVF. Okay, that's a very good question. Look, IUI is a very simple procedure where we take the sperm of the husband, we wash it in a special media, we have a special device to wash the sperm, clean the sperm, and then inject it inside the mother's womb. So these cases we try in patients whose fallopian tubes are normal and who are not very elderly. So usually it works very good in women of younger age group, especially below 35 years of age, and whose husbands have reasonably good sperm parameters. So normally we usually try for 2 to 3 cycles of IUI before we consider it to be a failure and then refer it for IVF in the near future. But if the patient is more than 35 years of age, we don't waste much time in doing IUI and wasting her time. We do 1 or 2 cycles and immediately refer the patient for IVF.
Just a curiosity question. Is there any long-term health risks for children born through IVF?
That's also a very good question. Most of the people have a myth that children born through IUI or IVF may have some birth defect or something like that. So let me give you a brief history of IVF. IVF, the first baby of IVF was born in 1978 in London. So it's almost 40 plus years. Till now, all the statistics and data have shown that there is no increased incidence of abnormal birth or increased rate of congenital anomalies in children born through IUI or IVF. This is settled once and for all. Rather it was found that babies born through IVF are healthy, they are more intelligent because the sperm that we select to do the IVF and the eggs that we retrieve from the mother's womb are of very good quality. So the resulting embryo is also very good. Sometimes in families where there are history of a congenital anomaly, like in family they have earlier children having some diseases. If we do IVF, then we can select the embryo. We can test the embryo before implanting it in the mother's womb, whether this embryo is also carrying that congenital anomaly or not. If the embryo is carrying that disease, we will discard it. We will not implant it. We will only implant those embryos which are good and which are genetically right to be implanted, so that the baby is healthy and doesn't carry the congenital anomaly that runs in the family.
So again, last question from my end.
Yes.
This question is for Dr. Belho. Since on a larger perspective, what we hear is that like IVF is an expensive affairs. So like in your hospital, you have already stated that like it is going to be affordable for the couples, for the citizen. So does it covers under any government schemes where citizen can take advantage of that?
As Nagaland government
is it only private?
In the last conversation with the minister, the health minister, about a year ago, I had also put this point across that if Ayushman or CMHIS can cover IUI and IVF, so they are still in the process of accepting this one. We are not certain yet. They have not informed, and I don't know whether it is still, we will follow through with that, but whether it is implemented is yet to be known. But otherwise, as of CMHIS and Ayushman, we are hoping that at least 2 cycles can be covered. I had requested for 3 cycles of IUI and 2 cycles of IVF. So that will help our people. But we are still not sure whether that can be implemented, but it's in the discussion.
Can I add a few lines? We get a lot of patients from Nagaland who are state government employees, and the state government reimburses a lot of the money that is spent on it, especially the medication and few procedures like ovum pickup and all. So I think 60 to 70% of the cost involved is being reimbursed by the government, provided they submit all the authentic documents.
They have their own formats. They share a format with us. We fill in the details of all the bills, of all the quantities of the medicines that are being used, all the procedures that are done. We self-attest it and we hand it over to the patient so that they can submit it to the insurer and they can get the claim back.
So another thing is that on an average, an IUI is costing somewhere 20,000 rupees per cycle. So we are bringing it down below 10,000 rupees per cycle.
Yes.
So which is actually a reduction compared to 20,000. And in terms of IVF, many centers are charging somewhere between 3 to 5 lakhs. So we begin with 1.3 lakh per cycle. So I feel that that is affordable when we compare it to the larger amount.
Yes.
Now, sir, how about the chances risk for the mother as well?
Risk for the
Regarding this idea.
regarding
You
IVF.
have just justified about the child.
Yes.
Not for the mother.
Okay. Nowadays, IVF has become absolutely safe because we have improved injection protocols. Earlier, the injections used to produce some reactions in the mother, like ovarian hyperstimulation syndrome. These are absolutely zero now because the kind of stimulation protocol that we use, which is an antagonist protocol, is absolutely safe for the mother. Since last 5 or 6 years, we have never got a single case of ovarian hyperstimulation syndrome till now. And it is a very safe and also painless procedure because the ovum pickup procedure that is done during an IVF procedure is done under anesthesia. So the patient doesn't feel any pain. So there is a myth among the people that IVF must be very painful and this and that. It's absolutely a painless procedure, starting from stimulation up to the embryo transfer. Nowhere is any operation or any painful procedure it gets involved.
Now, last one, question is that we give Punja and then to Nakami stage about the Shiva for the larger viewership concern. We have IVF from Shiva. Nagaland is a parent, Guwahati Jaina, it is cerebral one, language barrier, and we do financial. Successfully no, now after this Nova IVF collaborating with Dr. Belho'S clinic and Children Hospital, जो अपनी का patient का की साबुन कैसे अपनी क्या cycle का prices का सब कुछ है, but अपनी का नहीं hospital का तो patient के अपनी का clinic का ऐसा पड़ा साबुन, मतलब तक के कोड में पता होगा अपनी का नहीं area कुल बात इराकी ना अपनी का तो parent kan ki kai ko hoga ise to ulo pujai dibo.
Can I answer on your behalf?
Okay.
Let me answer so that she will take over from me. Can I talk in Nagamese also? Sabi, पहिला तो patients kan Guwahati te jale IVF nimite to 2 months 3 months বি থাকিব লাগে আজিকালি আমি খান কি কৰিব ডক্টৰ মাছাচিনো বেলৰ লগতে ফাৰ্ষ্ট কনসাল্ট কৰিব 5 days work of pre-IVF thing will be done here. They will go to Guwahati te jai kina 1 week aro thakibo, only 1 week, and we will take their eggs and the husband's sperm, and then after 1 week we will send them to her. Aro pichete when we make the embryo, in the next month we will call them for another 1 week. Tate jai kina 1 week thakibo, embryo to umte halibo, ako yate ahi jabo. Ahikina remaining period of the pregnancy will be looked after by Dr. Masasino Belho. So the earlier concept that Guwahati te jai kina shi maina thakibo lagibo follow up nimite itu to nohoy. So two visits to Guwahati. First visit 7 to 10 days, second visit 7 to 10 days, and the remaining workup will be done by Dr. Masasino Belho. Now you take over.
Yeah, ma'am, तो तभी बोले वो free IVF came to तो आजी विषय response की निकाल रही है.
আজিলা রেসপন্স তো বেশি ভাল থাকিছে আমি খান স্যার আর তাহালা টিম বি পারা তাক তো সিম্পলিফাইড ল্যাঙ্গুয়েজ para তাহান লগৰ কথা কৈছে এইনিগা IUI হবি IVF হবি এটো তো বেশি সাইন্টিফিক ডাঙৰ কথা ল্যাঙ্গুয়েজ চলাই কিনা কইলে তো পেশেন্ট মানুহ নাপুঞ্জে পাৰা তাক তো আমি খান বি নিজৰ নাগামিস para বুজাই দিবলে কৰে আজিলা রেসপন্স তো we had how many patients
We had around 20 patients.
20টা পেশেন্ট নিচিনা আজি চাইছে আৰু লাষ্ট IVF লাগা আমি খান ইটো বি more than 20 patients চাইছে awareness থাকি কিনা আহিছে কইলে তো আমি খান চাই দিব for sure and আমি খান বি জিনিগা মানুহ খান মই খান লাগা কমিউনিটি লা ইকোনমি বি বুজি কিনা সমজি বুজি কিনা কিনিগা মদত দিব পাৰে itu deal de ase ami khan laga the main thing is ki kurile khorcha bi komti kuribo aru ja aha duk sukh khan komti kuribo itu first ase but first aru second to para tak to iniga ekta family de bacha lobole mon jai ase koile to bishi deri rukhi gina sal rukhi gina nijor para hobole la rukhi thaka nokuri gina at least iniga para bhi madad pabole khan early care seek kuile bal hoboni ki itu koi ase.
One more question. Are there women under several health factors who will be unable to undergo the IVF or IUI treatment?
Yes, there are few contraindications of doing IVF, but these are very rare. For example, the government of India have said that patients with severe heart disease or kidney disease or patients who are suffering from cancer and all those things, and if they want to become mother, it's better not to implant the womb in them. We can take a surrogate mother. Itu bhi koribo pare. We can take the husband's sperm and the mother's egg, but instead of implanting the embryo in her womb, we can implant it in a third party. Surrogate mother ekta hoi jabo, taike embryo to tate halibo, aru bacha to carry koribo 9 months, pichete delivery hua pichete to ako biological parents ke to di dibo. Itu bi ase. Aru ajikali medical science to iman advance hoise. Ito patient laga diabetes thakile bi, thyroid thakile bi, aru haru kiba disease thakile bi medical to iman develop hoise during pregnancy ami khan to eto bhal pora control koribo pare. Dr. Masasino, she looks after all my IVF cases and she manages it very nicely, especially if there is any complication which develops like pregnancy induced hypertension ulalebi, diabetes during pregnancy ulalebi, aru delivery itu khan to sab tai ekdam bhal pora side hai. So there is no need of the patient going back to Guwahati after she becomes pregnant. Everything will be taken care of here. Aro second kotha to besi important ase, IVF baby khan to besi precious hoi thake, so we always ask them to get delivered in a good setup hospital where there is a good NICU, NICU koi ami khan, edo neonatal intensive care unit. বাচ্চাটো ডেলিভাৰী হ'ব হৈ কিনে কিবা কমপ্লিকেশ্যন হ'লেতো বাট কিবা একটা চাইল্ড কেয়াৰ লগা ছেটআপ থাকিলেহে তাতে কৰিলেতো ভাল so I'm very happy that Masasino Belho has taken that step forward and she has a very good team of pediatrician along with NICU facilities so IVF baby khan kiba complications ulale bhi pat treatment pai jabo so that is one of the very good thing that she has done and it is very beneficial for IVF patients earlier we used to call the IVF patients to go and deliver in Guwahati sorry but now we refer it here so that they can take care of the baby as well if there is any complications aru ekta kotha ase language naga manu khan to Guwahati te jai kina language problem hoy so since I am a Dimapur guy so I talk to them in Nagamis to beshi khushi pai ta khan to so this is also one of the advantages and the most important thing is that if we get a very poor patient for example below poverty line everyone wants to become a mother na sabhi baba ma hobole to so we try to even reduce as much as possible for those poor patients that facility also I personally look into it and see that our Nagaland patients get the best affordable treatment and care when they are there even accommodation when they go there they have to stay for a couple of weeks or 10 days or something like that so we arrange for them good guest houses and all lodges nearby our center so that it's convenient for them to come and go so that also plays a very important role as far as the convenience of the patients are concerned
so that means apni ko munjalo Nova IVF te
hoy
jun dukhiya manu ase takan gaone bi apni
consider koribole jaga ase exactly we are not very rigid because all patients economic status is not same no so Dr. Masasino Belho just informs me that this patient is little in the lower socio-economic side so please look into it so we do our best from our side
so last question from my end ma'am so aha samede apni kan hospital de arobi free IVF kendra thakibole apni national
Arobi free IVF to anytime ahile to free IVF hi hobo IVF matlab consultation hobo IVF to free na hobo but consultation to free hobo
and I'll be coming every month
and every month pariatak to survey time bisari kita ahibo tai team loigina aru one thing I want to mention here is that IVF kwa to sob age group karne nohoy paratak to 50 years below karne hi ase IVF is for women below 50 years aru parile to IUI to below 40 years hole bhal hobo
result to bhal hoy
result bhal hobole karne itu karne apuni 60 years hoigina IVF koribole to na bhabibi de
Sir, just one last question from my end. What is the success rate of Nova IVF so far?
yes so I was expecting this question Nova IVF is very transparent so recently we had a comparative study through an independent agency there are not so many IVF centers now in the country and we are the topper on an average keeping into view women of 40 years of age and women of 25 years of age because we get people of different age groups but on an average we are maintaining around 70% success rate but if the patient's age is less and if other things are good the success rate rises to around 90% failure in fertilization is almost nil in in Nova for the last 5 years of study that we have found that fertilization rate was around 98 to 99% ito sperm aro egg meet korea embryo baneado the failure occurs after the embryo is put inside the mother's womb miscarriages happen so that depends little bit on luck little bit on other factors how the patients follow up whether they are following up our directions or not what kind of lifestyle they lead and few other things as well but failure in the lab is almost 1 or 2%.
Last question deh, maybe nak habis kau boleh. Acha, just a legal question. as we all know that like government rabi regulation act konai na 2021 kan laga ART kan laga bi ase
Hoy.
to apni kan itu law lebi pero hospital lebi itu protocol follow na illegal practices such as gender selection kan ina ka hobole ni bole apni kan ki
Itu to beshi strict ase. Ami khan to whenever the patient comes to us, they will sign a consent form that they will never ask for gender selection, number one. Neither we will entertain such a question, number one. Number two, we strictly follow the guidelines made by the ART bill, which was passed in 2021-22. So we have to submit all our records. Kun ke IVF korise result aro result to ki hoise embryo kiman bonise kiman jon successful hoise to the central lab, which is being monitored by the government of India, and they come for inspection to check our records. So we are very meticulously following each and every clause of the act. So that way we are very transparent, and we follow the rules very strictly. So you know that we cannot even tell the sex of the baby once they become pregnant. So there is no question of selecting the sex of a baby before the baby is born. So this is an absolutely no. Because the punishment is so harsh nowadays. Even earlier some unscrupulous elements used to do this. I'm not disagreeing with you. But now according to the act, there will be 10 years of imprisonment for the doctor, and that is a non-bailable offense. So no doctors will take this risk, or no center will take this risk of sex selection and other things.
As per your experience, what is the percentage of numbers of people from Nagaland traveling to Guwahati or IVF treatment in a year?
Okay, so I do not have the exact statistics with me, but I personally get around 20 to 25% of my patients from Nagaland. So it's quite a big number, and they are not only from Dimapur, they are from Kohima, Mokokchung, Tuensang, Zonapoto, and all those places. Because we do not have a proper transparent center over here in Nagaland. One of our main aim to start this IUI is to make the patients aware that there is a center over here where they can at least come and get their basic treatment done and investigations done and be counseled properly what to do. Instead of going in some centers where they might mislead the patients. So here at least Masasino Belho and her team will be transparent in whatever we do. So that was the main aim of starting this unit over here.
So viewers, apni kan press conference dikhi paise Dr. Masisino T. Belho, proprietor Dr. Belho'S Clinic and Children Hospital, Northern Angami Colony, Dimapur. Tai brabi khota koise aro Dr. Mujibur Rahman, tai do IVF specialist Nova IVF Guwahati pra. Aro takan koi ase ki aji 18 April de jundu takan IVF laga free camp thakise, itu de more than 20 patients can aikina consultation luishi gushe aro takan ba koi ase ki jundu IVF laga opore public kan wrong conception thakise idu sob laga opore takan clarification bi kuri dishe aro idu IVF ekla nohikina IUI laga opore bi takan phal bra explain kurise. Dr. Mujibur Rahman bra koise ki IUI laga treatment debi Dr. Belho'S Clinic and Children Hospital Dimapur takan Nova IVF lokote already MOU sign kurigina takan itia collaborate kurna kam kurna jabu koi ase. So IUI laga opore bi takan phal bra explain kodise ki jun pacha lobole mon ase maiki khando below 40 years hobo lage IUI treatment karone aru itu laga opore bi takan explain phal bra koise ki itu laga treatment khando health risks ekunai aro jundu IVF babies kan bacha kan lobole mon jai ase pregnancy lobole mon jai ase itu laga opore bi koise কি মাইকী খান তো বিলো 50 years হ'ব লাগে আৰু পইলা টাইম দিতো বেছি মেৰিড কাপল খান IVF কাৰণে গুৱাহাটী আসাম দি যাব লাগে আৰু খৰচা বেছি ফিলাই আৰু ইটুইকলা নই কিনা ল্যাঙ্গুৱেজ প্ৰবলেম আৰু ইটুই নই কিনা more than 6-7 months দাদি ট্ৰিটমেণ্ট লৈ কিনা পোৱা দাম দে খৰচা বেছি ওলা লগাব পৰিবি কৈছে এতিয়াতো তাকান কৈ আছে কি নাগালেণ্ডে থাকা মেৰিড কাপল খান যোন মানুহ IVF ট্ৰিটমেণ্ট ল'বলৈ মন আছে এতিয়াতো গুৱাহাটী যাব নালাগিব হ'লে তাকান কৈ আছে কি ফাৰ্ষ্ট ট্ৰিটমেণ্ট কাৰণে এইটো নভা IVF গুৱাহাটী দি যাব তাদি যাই কিনা তাকান ট্ৰিটমেণ্ট ল'ব এক সপ্তাহ কাৰণে ফুৰিব আহিব আৰু তাকান ডক্টৰ Belho'S ক্লিনিক এণ্ড চিলড্ৰেন হস্পিটেল ডিমাপুৰ পঠাব এইটো পাছতে সেকেন্ড টাৰ্ম যাব যাই কিনা আহি কিনা তো ট্ৰিটমেণ্ট সব তো ইয়াতে ডক্টৰ Belho'S ক্লিনিক ডিমাপুৰহে তাকান ডক্টৰ মাচিচিনো টি পেলো আৰু তেলা টিম পৰাই চাব কৈ আছে আৰু খৰচাটো চাইছিলে IUI laga treatment do dusra hospital khandi do 20,000 loy ase kuise aro whereas Nova IVF laga do dusra center hospital khandi do 3 lakhs pra loi kina up to 5 lakhs ekta cycle di loi kuise holibi edi doctor Masisino di Belobra ko ase ki takan laga hospital di do IUI laga per cycle do khali 10,000 lobo aro IVF laga treatment per cycle do khali 1,30,000 brai shuru koribo ko ase আৰু যোন মানুহ মেৰিড কাপল খান বাচ্চা ল'ব মন যায় আছে হলিবি পইচা লগা দৰকাৰ আছে ইটো লগা ওপৰিবি ডক্টৰ মুজবুৰ ৰেহমান কৈছে কি নভা IVF তাখান পৰা ইটো লগা ওপৰিবি খায়াল কৰি দিব একমোডেশ্যন খান গুৱাহাটী দি যাই কিনা ফুৰিবলৈ দৰকাৰ আছে কলিবি ইটো নভা IVF পৰা চাই দিবলৈ লগা এচুৰেঞ্চ বি দিছে সো আপুনি কান ভাল পৰা শুনি লৈছে আমি কান নভা IVF তো চাইছোঁ কলে ইণ্ডিয়াতে more than 125 centers আছে আৰু more than 75 CD state akan run kuri ase aru itia for the first time ki Nova IVF Guwahati do Dimapur Dr. Belho'S clinic and children hospital Dimapur de aikina takan collaborate kurina janda kan benefit hobo karone takan koi di ase aru takan koise ki IVF babies lagabe eku risk nai pacha kan bi healthy ase health issues iku nai aru ma khan karone bi ajikali do with the technology ki treatment loa sab to health risks iku nai ko ase holibi यदि गवर्नमेंट ऑफ इंडिया पर जुन नॉर्म्स पुनाई किना आसे कि आपुनी खान IVF बच्चा खान लोबले मन जायसी गले माइकी खान आपुनी खान हेल्थ इश्यूज हार्ट प्रॉब्लम खान किडनी प्रॉब्लम नइले कैंसर पेशेंट खान आसे गले इदो खान कारणे दो IVF ट्रीटमेंट लोबले कारणे माना आसे सो इदो सब बुझिबि आरो जुन दो आपुनी खान IVF नइले IUI लगा ट्रीटमेंट डॉक्टर Belho'S क्लिनिक एंड चिल्ड्रन हॉस्पिटल डिमापुर दे लोबो मन जायसी गले नॉर्दर्न अंकामी कॉलोनी वॉलफोर्ड रोड ते आसे आरो तकान मॉर्निंग 9 AM बल लगिना तकान कंसल्टेशन कान दो खुले आपुनी खान नंबर स्क्रीन दि आसे ताते कांटेक्ट करबि आरो तकान मंडे बल लगिना सैटरडे दा खुला आसे इदो IVF ट्रीटमेंट लगा आरो कंसल्टेशन लगा दो हलिबि संडे दो बोनस सो व्यूअर्स आपुनी खान बे पाचा लोबुली लगा एकटा IVF ट्रीटमेंट लोबले मन आसे हलिबि तादे पैसा लगा दरकार आसे नइले फाल बरा आपुनी कान कंसल्टेशन लोबो मन जाय गले डॉक्टर Belho'S क्लिनिक एंड चिल्ड्रन हॉस्पिटल डिमापुर आइकिना नंबर दिना थाका जगह दे अपॉइंटमेंट बनाइना फाल बरा ताकान लोगते बुझिले बेसी फाल होबो आरो इटु एकला नइकिना आपुनी कान IUI लगा ट्रीटमेंट भी लोबले मन जाय गले नंबर दिना थाका जगह दे कांटेक्ट करि आमी कान होप करिबो यदे डॉक्टर Belho'S क्लिनिक एंड चिल्ड्रन हॉस्पिटल डिमापुर वादा करा निसना ताकान इदो IVF लगा फ्री कैम्प कंसल्टेशन दो ताकान टाइम एंड अगेन लुई থাকিব কৈ আছে নম্বৰ দি না থাকা জায়গাতে কন্টাক্ট কৰিলে আপুনি সব কাৰণে ভাল হ'ব ভিউয়াৰ্স এতিয়া কাৰণে ইমানেই ফৰ মোৰ আপডেটছ আপুনি চাই আহিব গ্লোবাল উইন্ডো মই এছিষ্টেণ্ট কমায়াৰ উইথ কেমেৰা পাৰ্সন মনখাবা জামিৰ ৰিপৰ্টিং ফ্ৰম ডক্টৰ Belho'S ক্লিনিক এণ্ড চিলড্ৰেন হস্পিটেল নৰ্দাৰ্ণ আংগামী কলোনী ডিমাপুৰ